Hello everyone, I'm Dr. Sunil Garg, consultant physician and critical care specialist. In this video, I'm going to discuss procalcitonin kinetics and its usefulness. What is procalcitonin kinetics? Procalcitonin kinetics is tracking its level over time. Before delving into the procalcitonin kinetics and its usefulness, I will be discussing how procalcitonin works whenever there is infectious or inflammatory stimulus. So whenever there is an infection or the inflammation, procalcitonin level begin to rise within 2 to 6 hours, and its level typically peaks within 24 to 48 hours. With the resolution of the inflammation or the infection, its level starts to decline at a predictable rate, and that rate is around 50% of original value every 1 to 1.5 days. But in renal dysfunction, this procalcitonin kinetics is altered. Now we will discuss how this procalcitonin kinetics is useful in the management of critically ill patients. Usefulness 1. It helps in assessing severity of infection and sepsis. Since procalcitonin levels roughly correlate with bacterial infection severity, while rapidly increasing procalcitonin suggests worsening sepsis or an uncontrolled infection, higher initial procalcitonin values are associated with more severe infections and a higher risk of septic shock. Usefulness 2. Prognostic value. Persistently high or rising procalcitonin levels indicate a poor prognosis and a higher risk of mortality. A decreasing trend suggests effective infection control and better patient outcome. Usefulness 3. Detecting complications. Failure of procalcitonin to decline despite treatment may indicate secondary infections, abscess formation, or treatment failure. Procalcitonin kinetics help differentiate between systemic inflammatory response syndrome due to surgery and postoperative infections. Usefulness 4. Antibiotic stewardship. Declining procalcitonin level helps guide antibiotic de-escalation, reducing unnecessary antibiotic use and minimizing resistance risk. Usefulness 5. Differentiating bacterial versus non-bacterial inflammation. Procalcitonin rises significantly in bacterial infections, but level remains low in viral infections and autoimmune disease. Usefulness 6. Guiding clinical decision making. If procalcitonin does not decline by at least 80% over 72 to 96 hours, clinicians should reassessment treatment planning, like imaging for abscess or changing antibiotics. Usefulness 7. Making discharge planning. Higher discharge procalcitonin levels means if levels are more than zero point 0.5 to 1 nanogram per ml, it is linked to increased risk of early readmission and post-discharge complications. A significant decline in procalcitonin supports transitioning patient from ICU to ward care, but patients with persistently elevated procalcitonin may require closure, post-discharge follow-up, or extended hospital stay. Discharge decisions should always be based on clinical recovery, hemodynamic stability, resolution of the sign and symptoms, microbiology, and imaging results, and not just the procalcitonin value. Procalcitonin kinetics offer invaluable insights into infection progression, treatment response, and patient outcomes. By incorporating serial procalcitonin measurement into clinical practice, we can improve decision makings, optimize antibiotic use, and ultimately enhance patient care. If you found this video helpful, please share, like, subscribe, and hit the notification bell for more medical insights. See you in the next one. Till then, bye and take care.